Friends, welcome to Sifma's Marketing Establishment. Today, we are going to talk about coronavirus. So let's get started. COVID-19 is the disease caused by the coronavirus that emerged in December 2019. COVID-19 can be severe and has caused millions of deaths around the world, as well as lasting health problems in some who have survived the illness. The coronavirus can be spread from person to person. It is diagnosed with a laboratory test. COVID-19 vaccines have been authorized for emergency use by the US Food and Drug Administration, and vaccination programs are in progress across the US and in many parts of the world. How does the coronavirus spread? As of now, researchers know that the coronavirus is spread through the droplets and virus particles released into the air when an infected person breathes, talks, laughs, sings, coughs, or sneezes. Larger droplets may fall to the ground in a few seconds, but tiny infections particles can linger in the air and accumulate in indoor places, especially where many people are gathered and there is poor ventilation. This is why mask wearing, hand hygiene, and physical distancing are essential to preventing coronavirus. How did the coronavirus start? The first case of COVID-19 was reported December 1, 2019, and the cause was a then new coronavirus, later named SARS. May have originated in an animal and changed so it could cause illness in human. In the past, several infectious disease outbreaks have been traced to viruses originating in birds, pigs, bats, and other animals that mutated to become dangerous to humans. Research continues, and more study may reveal how and why the coronavirus evolved to cause pandemic disease. What is the incubation period for COVID-19? Symptoms show up in people within 2 to 14 days of exposure to the virus. A person infected with the coronavirus is contagious to others for up to 2 days before symptoms appear, and they remain contagious to others for 10 to 20 days, depending upon their immune system and the severity of their illness. What are the symptoms of coronavirus? COVID-19 symptoms include cough, fever or chills, shortness of breath or difficulty breathing, muscles or body itches, sore throat, loss of taste or smell, diarrhea, headache, new fatigue, nausea or vomiting, congestion or runny nose. Some people infected with the coronavirus have mild COVID-19 illness, and others have no symptoms at all. In some cases, however, COVID-19 can lead to respiratory failure, lasting lung and heart muscle damage, nervous system problems, kidney failures, or death. If you have a fever or any of the symptoms listed above, call a doctor or a healthcare provider and explain all your symptoms over the phone before going to the doctor's office. How is COVID-19 diagnosed? COVID-19 is diagnosed through a laboratory test. Diagnosis by examination alone is difficult since many COVID-19 signs and symptoms can be caused by other illness. Some people with the coronavirus do not have symptoms at all. How is COVID-19 treated? Treatment for COVID-19 addresses the signs and symptoms of the infection and supports people with more severe disease. For mild cases of coronavirus disease, your doctor may recommend measures such as fever reducers or over-the-counter medications. More severe cases may require hospital care, where a patient may receive a combination of treatments that could include steroids, oxygen, mechanical breathing supports, and other COVID-19 treatments in development. Infusions of monoclonal antibodies given to certain patients early in the infection may reduce the symptoms, severity, and duration of the illness. How do you protect yourself from the coronavirus? Vaccines are now authorized to prevent infection with SARS-CoV-2, the coronavirus that causes COVID-19, but until more is understood about how the vaccines affect a person's ability to transmit the virus, precautions such as mask wearing, physical distancing, and hand hygiene should continue, regardless of a person's vaccination status, to help prevent the spread of COVID-19. Learn more about COVID-19 vaccine and ways to protect yourself. Why is it called coronavirus? Coronavirus are named for their appearance. Corona means crown. The virus outer layer are covered with spike proteins that surrounding them like a crown. Is this coronavirus different from SARS? SARS stands for Severe Acute Respiratory Syndrome. In 2003, an outbreak of SARS affected people in several countries before ending in 2004. The coronavirus that caused COVID 19 is similar to the one that caused the 2003 SARS outbreak. Since the COVID 19 is related to the original coronavirus that caused SARS and can also cause severe acute respiratory syndrome, that is SARS in its name, SARS CoV 2, much is still unknown about these viruses, but SARS CoV 2 spreads faster and farther than the 2003 SARS CoV 1 virus. This is likely because of how easily it is transmitted person to person, even from asymptomatic carriers of the virus. About coronavirus. Coronavirus are common in different animals. Really, an animal coronavirus can infect humans. There are many kinds of coronaviruses. Some of them can cause colds or other mild respiratory, nose, throat, lung illness. Other coronavirus can cause serious disease including severe acute respiratory syndrome SARS and Middle East respiratory syndrome MERS. Stay home, stay safe, stay connected with us. Subscribe our YouTube channel and get notified with bell icon on.